So my name is Pam Davis. I'm the team manager for intake services based here at the James Fletcher Hospital in Newcastle, which comprises the mental health line, mental health first responder and Northern Emergency Care Rural Access Program, MECRAP for short. The team is multidisciplinary, so we have registered nurses, occupational therapists, social workers and psychologists. They all do the same role across the three streams of the service: telephone triage. Mental health first responder is triaging in the field for police and ambulance personnel, and the MECRAP part of the service is doing full mental health assessments for people who present to EDs in rural areas. So of my approximately 25 staff, they work a rotating roster. They all work a combination of morning, afternoon and night shifts, 7 days a week, including weekends, public holidays. The team is very supportive here. They're just great. They get in and help each other. If somebody's sitting close to somebody and they can hear that they're having a phone call with somebody who's a bit distressing, they'll offer help. Often actually we have to call emergency services, police or ambulance. Staff will jump in to assist with that. After a phone call, if somebody's had a difficult time or they're feeling a bit upset, then the staff will take the time to support each other, to listen to each other, maybe go and sit for 5 minutes and have a couple with that person. They look out for each other. There's about 5 or 6 clinical information systems to learn. We put them through training. As we go through, we sort of make sure that they're competent to move on to the next step in the process, and we ensure that people feel comfortable before we let them take on the next step of the training. One of the really great benefits about working in this service is that we cover the entire Hunter New England local health district. We work with all of the emergency departments across the district, which is really good because you get to know clinicians in other areas, you get to know some of the staff in the EDs and whatnot. We're providing a service to patients and their families across the entire district, which is really quite unique. For somebody who's considering a career at the mental health line but it's not quite sure, let me reassure you that you will use all of your mental health clinical skills in this type of work. Whilst there's no direct client care, there's no case management, there's no counselling, there's no ongoing follow-up, there are lots of really complex skills that you need: risk assessment skills, suicide risk skills, triage, mental health assessment. There's lots of really complex skills required. In fact, you'll find every day that you're using probably different parts of the training and knowledge that you've gained in your career. They're having no direct contact with patients. For some people, might make them think that they won't enjoy the work. I think that we do mental health assessments over My Virtual Care through telehealth. So you are seeing the patient at a distant site through a video as they are seeing you sitting here in Newcastle. And people still rely on, whether it's over the phone or whether it's VC, people still rely on you to be able to make an assessment and help them and find the best outcome for them in the long run. Come and join the team.
I'm Sarah. I am a registered nurse, have been for many years. I work at the mental health line here in Newcastle, based at the old James Fletcher site. I've been here for 2 years. I came from an inpatient facility. Just thought I needed a sea change because there is the sea that's just outside. And I'm able to utilise all of my mental health training that I did at university. Day to day is that you come in, you set yourself up for the day. So we go through Chime, which is our service that we have access to people's files. We get calls that come in from distressed family members, so third-party referrals. you're allocated a tier, so either you receive the calls or the calls are put through to you, so you do a triage or a third party. We also get referrals from GPs. You get to know all your community team because you majority of the time you're having chats with them. I find it also great here for this finding out from other people because we're multidisciplinary. I'm a registered nurse. We've got occupational therapists, social workers, psychologists that are here, and you can pick their brain if they know any other services that are out there to help people. Teamwork. If you've got an issue with someone on the phone, you can debrief at the end of a triage. The exciting part is that I get to use my skills in triaging people in other emergency departments when you get to see them sit